So during the kettlebell swing, should I keep my neck straight and just nice and neutral and just kind of get my eyes up and down, up and down? Should I maintain the face kind of pointing forward and just kind of go through the neck motion? Or should I maybe look down, point the head slightly downwards and kind of slow down that motion? Or actually, why should I care at all? I used to believe that during the kettlebell swing, the neck should be kept straight, like in that strong packed position, the same way like when you're training deep neck flexors. What got me to question this was a really good webinar about the kettlebell swing by Benjamin Stevens. Actually, shout out to him. I learned more about kettlebell swing during that webinar than actually possibly all of the combination, all of the information combined together. But he proposed that instead of keeping the neck in the neutral position, we should allow the neck to move a little bit kind of up and down to avoid the shear force. Initially, I was actually quite confused, which personally I really love, because I remember the quote on the top of above the bed when I was with a good friend of mine, Robbie Burke, and there was a big sign on his whiteboard, question everything. So when something gets me to stop and think, and when I see somebody who knows obviously way more about the subject like I do, doing something completely different or kind of challenging my thoughts, I'm like, okay, what's going on here? I need to look a little bit more into it. Also, why it was actually quite important for me, just to give you a little bit of background, I broke my neck twice in 2013 and in 2018. 2013 it was the C1 fracture, and 2018 was C7. So kind of information how to load the neck, how to train the neck, and how to understand those kind of like small details are kind of really important for me, but also they're important for the patients I'm treating, and also for the clients who I'm training. So after the webinar, I was trying to kind of figure out what's going on, but I'm not that fast, and usually it takes me a little bit of time to basically figure out like why the things are the way they are, and just to understand the aspects, and especially to be able to explain it hopefully in the simple words. So which way is the right way? Should we move the neck? Or should we keep the neck tucked and just kind of move the eyes and maintain the horizon? Or should we do something in between? So what I'm going to do now is just try to go over all three types and explain you kind of for and against it, and maybe brainstorm a few ideas. So hopefully afterwards you're going to be able to decide for yourself and maybe for your clients, like, okay, what is the most efficient way to do, and maybe one model doesn't fit for all of the patients. So the first one is basically what I'm going to do is the packed neck. You are kind of keeping that nice long position. From DNS it would be just back neck or just nice and tall, and you are maintaining that position, fixing your eyes kind of on the horizon or down over there. What this movement actually does, maintaining that motion, keeping it straight, the head is a little bit heavier, so it maintains a little bit of forward momentum. So there is definitely going to be shear force, which is going to be kind of doing this to the vertebrae when we are going down. But also there is going to be shear force where we are going backwards, using that momentum, slowing down that kettlebell swing from the hips, which is going to be backwards. I think this backward shear is actually very beneficial for most of the people, because as we are usually sitting, usually the gravity works this way. So I think that backward shear force actually helps to create a little bit of relief. Oftentimes actually the relief which we are doing with the patient when they are kind of suffering with some kind of disc or neck pain. So again, to consider, is the shear force good or bad? It really depends. Like, it really depends on the patient, on the client. But there is definitely a shear force, or at least in my understanding, there is definitely a shear force when you're trying to keep your neck nice and packed, and when you're doing the kettlebell swing like that. The other option, or the other variation, is basically you would be doing your kettlebell swing and you would be looking just straight forward. Again, like, is this right or wrong? In my opinion, it's kind of neither, because we just need to understand what kind of forces there are going to be on the neck, and just to be, is the person able to tolerate and handle them, get used to them, and is it something what we want to target for the neck, let's say for the neck training. So what happens with this kind of style, this movement, when your face is basically where your head is maintaining that vertical alignment and you are just moving your body, you're going to move your neck into quite forceful extension. In my opinion, again, like it's neither good or bad. Let's say if you are able to tolerate that extension, if you have nice range of motion in the neck, you have very good upper back mobility, and you have enough strength and capacity of those muscles in the front just to be able to slow down that motion, you should be pretty fine. Once more, if you have any kind of nauseous feeling or dizziness when you are turning or when you are looking backwards, kind of extending your neck, you might have a little bit of insufficiency in your vertebral artery, so maybe this wouldn't be the most efficient way how to do the swing. Or me personally, I wouldn't do it with that client which kind of have those kind of symptoms. In this kind of movement, just to understand the forces, we are replacing that pure shear force with ability to extend fully of the neck, so with that eccentric extension of the neck with its control. So the patient or the client has to be able to control this kind of movement, slow it down. Otherwise, if they're not able to do it, at the end there is going to be the shear force anyway. So you're getting two at once. And the third option is basically to keep the head. You are standing straight, you are kind of looking slightly down, looking and also having the head position there, and just going kind of maintaining that head position or allowing it to move a little bit. So that's going to kind of bring, you will have to be able to decelerate a little bit of flexion, a little bit of extension, and there is going to be a little bit of shear force. So I think this is possibly one of the best balanced techniques, just the force production or force toleration or for the movement of the neck. Again, is it good or bad? It really depends. Let's say if the patient is kind of a little bit flexion intolerant, so when they are flexing the neck, they get some kind of like tingling symptoms into the arm. So we kind of clearly see that the flexion is kind of a little bit provocative. I don't want to say it's pushing the disc out, so it's touching the nerve, so it's creating this tingling, but whatever it is, if they have those kind of symptoms, if they don't tolerate the flexion too much and we are not able to improve it with certain techniques we use, then maybe this wouldn't be my preferred choice for that flexion intolerant, let's say, patient. You might ask, why would that person want to swing? Well, a lot of people want to do a lot of things despite what they feel, what their body is telling them or go through. So again, just giving you a few different options like when to use it and maybe when not to use it. So which of these types of the movement or neck position should we actually choose when we are teaching somebody, the client or the person, to how to do kettlebell swing? Like in my opinion, I usually teach the neutral neck, so not really hard retraction, but just keeping the neck nice and tall, looking slightly down, and using mostly the eye movement, with the idea trying to maintain that neck position kind of reasonably straight, so not to move in the neck. In the reality, they're going to move a little bit, they're going to lose that position up and down just as they are buffering, as they are slowing down those forces. But definitely I don't want them actively trying to keep the face certain direction. They should basically treat their neck like their back. So there is always a little bit of flexion and extension during the kettlebell swing, but it's not intentional. On the other hand, if I'm working with somebody who is like athlete, who is kind of into a little bit more extreme, who needs to withstand a little bit more extreme forces, let's say like a motorbike racer, people like that, then I would be thinking, okay, depending on the stage of their rehab, I might definitely move them into that stage where they move the head and they need to slow down, condition those muscles, and even those, let's say, discs and all of those tissues, just to slow down, just to be able to control the movement. Because again, like it's more like the adaptation process. We need to just be able to spread the load over the body and just let them adapt to it. The other part with the moving the neck straight and being able to kind of withstand those forces is it can have definitely a little bit of preventative measures. Let's say in the case of the person is looking up, they're running, they're trying to catch the ball and somebody hits them and the neck basically goes through that very much so the momentum is still going forward, and as they get hit, they might get basically into this position. So there's going to be quite forceful extension. This kind of training can have quite preventative measures against the concussions and against just being able to react, slow down without having that visual field. But again, that's a little bit too much into the rabbit hole. Otherwise, if I go that way, that this video would have well over, I don't know, half an hour or something like that. This, just quick note, our visual, just being able to visually see something and being able to react on the forces might be the main difference why you don't usually get knocked out by the punch you see. It's usually the punch you don't see, so your body doesn't have that pre-tension, it's not able to slow down the motion. And the other thing is we usually get injured by the forces which we don't see. So is there a way we can train for them? I don't know, that's open for discussion. So what I would like to close this video is there is no right or wrong. I think there are some better ways for some people how to train the kettlebell swing in regards to neck. Guys, hopefully this was helpful. Again, just a few questions, few different considerations, what to think about. If you have any comments on this, please just let me know. Okay guys, good luck.